Right, so let's begin blood sampling. So we have got scenarios on blood sampling, and we also have got on blood culture as well. So how it is done and how it is done, you can see it in the video, but main point that I'm going to discuss here would be how much history we are supposed to take. Yeah, so when you're doing the blood sample, we know we will be having all the different colors of Vacutainer as well. So make sure you remember these colors. They can ask you in the exam. For example, the blue top color is for which investigation, the yellow is for which investigation, the purple is for which investigation, the gray is for which investigation. So make sure you know this. I know what happens, in the hospitals, if a patient is admitted in the ward and you are the ward doctor, you have got a clinical room where all these things like the Vacutainer or all these other instruments. For example, you need a kidney trace, tourniquet, alcohol swab, Vacutainer needle, holder, tubes. All these are there in the clinical room. So what we usually do, we take our tray and we take whatever we need, and then we go to the patient. And in that clinical room, we have got the picture, which tells us that blue top is for this investigation, yellow is for this investigation. So to be honest, once you start working, you don't need to remember these things. But for the exam purpose, I would say, yes, you need to know everything about it. Yeah, because if you don't know, you might have struggled in the exam, right? Because they might be asking these things, right? So we should be thoroughly prepared. Now, when you're doing the blood sampling, see, you have got two options. Number one, you can use the Vacutainer holder and Vacutainer needle to do the blood sampling, or sometime you will see they will have a butterfly needle as well. So you can go through butterfly needle as well. It doesn't matter at all. However, remember one thing, when you are doing the blood culture, always use butterfly needle. When you are doing normal blood sampling, you can either use butterfly needle or you can go with Vacutainer needle, Vacutainer holder. That's absolutely fine. Whatever you will find, just go accordingly with that. Okay. Now, let's have a look at the scenario. The video for the blood sampling, you can definitely see on our YouTube channel. Okay, so you are in A&E. Your patient is 25 years of age, has taken some paracetamol tablets. Okay, the task is do venipuncture for the necessary investigations, talk to the patient history, and discuss the management with the patient. All right, now it depends what kind of history you're going to take here. Where you are, it depends on that. You are in A&E. See, patient has taken some paracetamol tablets. So now the patient has taken 10, 20, 30 tablets. It means you have to take psychiatric history. Patient might be a psychiatric patient. Patient might be under stress. But when you are in A&E, what is your main aim? Your main aim is not to find out why the patient took the tablets. Your main aim is to save the life of the patient. So that is really important. So do not miss this particular point. So the history that you're going to take is going to depend on where you are. If you are in A&E, the history is going to be a bit different. If you are in psychiatry, the history is going to be different. So you are in A&E, patient is 25, has taken some paracetamol tablets. So what kind of history you're going to take? So you will take history, which is medical history here. Medical history, which is going to be very helpful in your medical treatment of this patient. Not like, why did you take these tablets? Don't ask that question. It's not required. Your aim is to save the life of the patient. When you enter into the cubicle, you may see these patients are not very comfortable talking to you. They're not opening up. They're not giving information to you. So what you need to do, maybe you have to spend a minute just to make them comfortable, just to win their trust, just to reassure them. So that is something that you need to do in the beginning, right? So make them comfortable first, and then you'll start taking medical history. How can I help you? Doctor, I've taken some paracetamol tablets. Okay, then you will ask, what are the questions that you can ask? You can ask, how many tablets did you take? Right, doctor, I've taken 40 tablets. Okay, because if it is paracetamol poisoning, it has to be at least 24 tablets, 12 grams, right? So how many tablets? 40. Then next question I should ask is, when did you take it? When? Doctor, I took it like 6 hours ago. Okay, all right, that's absolutely okay. So how many tablets? 40. When? 6 hours ago. What are other questions that you should ask? You can ask, is it like, did you take it in one go? Did you take it in one go? So that is very important. Yeah. What else I should add? You took it with what? You took these tablets with water or something, right? So that's very important. Ask the patient if they have taken any kind of alcohol. Ask if they have taken any other drugs or not. So that is the main thing, because this is going to be helpful in your treatment, medical treatment. Then you will ask if this patient has got any symptoms of paracetamol ingestion. Which symptoms I should be talking for? I'll be asking for if the patient has got tummy pain. I'll be asking for if my patient has got any nausea, vomiting. I can ask for if my patient has got any dizziness. Yeah. So that's something that you need to ask. Do I need to ask why did you take these tablets? Not really. Don't ask that question. Now, if you have got time, you can go in past medical history as well, asking if the patient has got any medical condition related to liver, related to any blood disorders, right? So that is something that you can ask. Now, listen to this very carefully. Sometimes you will see this patient is not opening up, and it may take a bit longer just to reassure the patient. And they have taken like 1 minute of your time, and they're not giving the answers very easily. They're taking too much of time in answering your questions. So reduce the number of questions. If I got to know how many tablets, 40, when 6 hours ago, to be honest, it's enough. This much information is enough for me to go ahead for the blood sampling. When do you do the investigations for plasma paracetamol level? Usually you do after 4 hours. So this is 6 hours ago, patient has taken the tablets. So can I go ahead and do the blood sampling? Yes. So, I mean, you can take this much of history, but if the time is not allowing you, you'll see that I'm in a difficult situation. I can't ask too many questions. Why? Because patient is not answering. So if you even ask these two questions, you can go ahead and do the blood sampling. Right? Now you explain it to the patient, first of all, that I'm going to take blood from one of your veins of your forearm. It's going to feel like a sharp scratch. Use this word, sharp scratch. It's going to feel like a sharp scratch. I'll be gentle and quick. And at any point of time, you feel uncomfortable, let me know. I'll stop the procedure. Another thing, I may have to do it again if I'm unable to get the blood in my first attempt. Because it can happen that you tried and you didn't get the blood. It happens in real life as well. It can happen in the exam as well. So just make sure you mention it to the patient already, right? You can ask if there is any arm preference, any weight preference, and then you'll take consent. May I proceed, right? And please just roll up your sleeves. That's it. Now, do I need a chaperone? You can mention, that's absolutely okay. But in the hospitals and all, you will see during the blood sampling and all, we don't usually take a chaperone. So if you want to mention, it's okay. If you miss, that's fine as well. That's absolutely okay, right? That's what you have to do. So history, can we do in 2-3 minutes? Of course, because I just said just ask 2 questions, that is enough. If the patient is talking, you can ask a few more questions as well. Otherwise, don't go into too much of detailing. And then what you do, you're going to do the blood sampling. You got the blood or you didn't get the blood. So if, for example, you didn't get the blood, what you're going to do, try it once more. Now, you have taken the vacutainer and you tried getting the blood, you didn't get the blood. Okay, no problem. Try it again. Now, one common mistakes that a lot of candidates they do, they use the same vacutainer. No. See, if you have tried and the blood didn't come, that vacutainer is useless now. There is no vacuum in this. So what do you do? Please discard that and get the new vacutainer. Right? So, and then you try. So maximum 2 times you can try. Try once, not successful, try once more. And if you're still not successful in your second attempt as well, tell simply that I'll ask one of my colleagues, they'll come and do the blood sampling. Don't try more than twice. Why? Because you try twice, it's better your friend try. Second is, I don't think so you'll have that much of time in the exam as well. Moreover, if your technique is good, they might help you as well. Because, see, if your technique is good, the problem might be with the mannequin. That can happen because it's a mannequin, right? So what can happen is they might give you the desired results. Because you simply say after you get the blood, what you're going to say that I'm going to send send this blood for the investigation. Which investigation you would like to do? I would like to do routine blood test. I would like to do coagulation profile. I would like to do liver function test. I would like to check for plasma paracetamol level. So all these things you have to mention. When you mention, they might give you the investigations. That's what we need. Because what is the treatment for plasma paracetamol poisoning? I mean, what is the treatment for paracetamol poisoning? See, if it is the first hour, if it is the first hour of paracetamol ingestion, if it is the first hour, you can go for gastric lavage as well and do the treatment. Otherwise, After 4 hours only we check the plasma paracetamol. We do not check before that. Yeah, we check it only and only after 4 hours, right? If the patient has taken more than 24 tablets, you can start the treatment as soon as possible. If not, then you will do the investigations after 4 hours. And then how you're going to check? You're going to check through this graph to see if we have to start this patient on the treatment. The treatment is N-acetylcysteine. For example, let's see. So patient took the tablet 6 hours ago. Yeah. And when you did the investigations, for example, you got the plasma paracetamol level is 84. Plasma paracetamol level is 84, for example, they said. Let's see if this patient needs the treatment or not. So if you see, this is time in hours, and this is your plasma paracetamol concentration. So I said 6 hours. Yeah. And the level is 84, somewhere here. So 6 hours, can I say it is somewhere here? Anything on this side of the chart, what does it mean? Anything on this chart, in this side of the chart, what does it mean? Patient needs the treatment. Now, patient might say, I'm absolutely fine. I'm okay. I just want to go home. But the thing is, can you send the patient home? Not really, not really. So what you have to do is you explain this chart to the patient. They have to give you this chart in the cubicle. Otherwise, you can't make the diagnosis. You cannot treat the patient. You don't know what to do. So chart has to be given to you, right? So then you explain. You explain this chart that, see, what's the name of our patient? Billy. See, this is the time in hours. This is your plasma paracetamol concentration, right? So you took it 6 hours ago, as you mentioned, and your level came back 84. So it is somewhere here on this side of the graph. So what does it mean? It means we need to keep you in the hospital and we need to treat you by giving, what are you going to give? N-acetylcysteine. Yeah, so we have to give you IV infusion of N-acetylcysteine. We have to keep you in the hospital. If patient says, I don't want to stay in the hospital, I'm fine, I'm going to go home. So tell the patient, we need to monitor you. We need to give you the medication through your blood vessels. So that's why it is advisable you stay in the hospital. So for how long you usually give the infusion? You usually give it for 21 hours. We give the infusion for 1 hour, 4 hour, and then 16 hours. So in total, 24-hour infusion is given. After that, what we do? After that, what we do? What we do? We actually review the patient again, and we do all these investigations plus the paracetamol level again. And if everything is okay, patient is asking, is everything okay? If everything is okay, can I go home? So are you going to let this patient go home? Not really. So now what I'm going to do, I'll be sending this patient to the psychiatrist, right? Because do you think a normal person will take 40 paracetamol tablets? No, there is something going on, isn't it? Patient is under stress. So that's why make sure you make a referral to the psychiatry team. You will only refer the patient to the psychiatry team when the patient is medically stable. And that's why I didn't ask questions for psychiatry as well. Now some candidate ask me, can I ask these questions in the end? You can after doing this medical treatment, but do you think you will have enough time to ask those questions? I don't think so, because you're taking a bit of history, then you're doing the procedure as well, and then you're explaining the management to this patient. Patient might not agree to get this management because patient is feeling I'm absolutely fine in terms of symptoms. So it is going to take time for you to explain all those things to your patient, right? But if you have time, yeah, no, don't worry at all. You can take psychiatric history as well. I mean, why did you take these tablets? Who was there with you? Who got you to the hospital? Have you tried it before? Any plans to do it again? How do you feel about it? Lots of questions, I mean, right? So you don't need to be honest, go into that much of detail because you are the doctor in the A&E and your job is simply to make your patient comfortable, make your patient medically stable, right? So that is the main thing here. Now, they've got another station as well for the a blood culture. So you are in general surgery, patient is 27, has been diagnosed with a ruptured appendix. Patient underwent a surgery a few days ago, and consultant has asked you to go for blood culture. So maybe after ruptured appendix, you might have started this patient on the what do you say, on the after the treatment for the antibiotics and all, right? But maybe patient is having high fever and patient fever is not coming down. So you can take a bit of history. How are you feeling? How the surgery went? Any problem at all? Any pain? Any nausea, vomiting? Are you able to eat or drink well? Any fever? All those questions you can ask. And then you need to explain that I'm here to take blood sample for you, right? So the only thing that I want to tell you is you will have these blood culture bottles. Sometimes they give you these kind of blood culture bottles. Sometimes they give where the neck is a bit narrow, something like that. So it doesn't matter. So you just need to know we have got a bottle which is brown color, we have got one bottle which is blue color. I told you one thing, whenever you're doing the blood culture, please use butterfly needle. Don't go for vacutainer or vacutainer needle. Go for butterfly needle. Butterfly needle, and you will have this blood culture holder as well. Now, so this blue cap is for aerobic and the brown cap is for anaerobic. Now the question is how much blood I should be collecting. So remember guys, how much blood I should be collecting. So you should collect at least 10 ml each, right? So you will see in these bottles, the marking is going to be there. There will be some solution in it. So for example, the solution is saying, okay, solution is there till 25 ml. So make sure you fill it till 35 ml. Yeah, so roughly 10 ml. Again, if it is couple of mLs more, couple of mLs less, if it is 8 ml, 15 ml, it is not going to make much of difference, right? In real life as well. But if somebody asks you how much blood you should be taking, it is 10 ml each. Yeah. Now, if somebody asks you which bottle you're going to fill first, or it is not going to make any difference, which bottle I should fill first? Should I go with the aerobic one or should I go with the anaerobic one? Or it's not going to make any difference. So the thing is, I will tell you one thing. Okay, so if I ask you which is your favorite color, brown or blue? To be honest, whenever I ask this question, I always get the answer blue. So I always say go with the blue bottle first. Yeah, so you fill the blue bottle first, the aerobic one first, and then only you will go for the brown, that is anaerobic, and you go for 10 ml each. That is it. So this is the thing that you should know. Otherwise, rest of the procedure is going to be the same as you have done in the blood sampling. Everything will remain the same. So that is what you are supposed to do in your blood sampling or blood culture. All right. Okay, let's see some questions if you have got. Need consent, of course, yeah. In this station, you have to take one yellow top bottle. To be honest, in real life, I'll be taking so many bottles, but in the exam, they don't have the different colors, to be honest. So whichever color they have given, you can take it, but they will ask you the question, what is yellow color top for? What is blue color top for? So you should know the answer, yeah. Plasma paracetamol level graph is given, of course. Will the examiner give the levels after you have taken the blood? Yes. What is the minimum number of tablets? I think that is answered. Do we need to make sure to fill it up? Do we need to make sure we fill it up? You mean for the blood sampling? Yeah, you fill it. The thing is, because of the vacuum, it will fill. But sometimes the pressure might not be enough in the mannequin. So even if you get 2, 3, 5 ml, that's absolutely fine. Yeah. Any specific reason why blue first, please? Because of aerobic and anaerobic, doctor. Because of aerobic, you will take first. That's the reason. Yep. So that is it for this scenario, right? So, I mean, history-wise, just be quick. You're not supposed to spend too much of time in your history. Be quick, be quick. Yeah. And you will not fail the station if you didn't get the blood. You will fail the station if you didn't discard your sharps properly in the sharps bin. You may fail the station if you didn't open the tourniquet on time, right? So if you didn't get the blood, you may still pass the station. I know so many candidates, those who pass the station even without getting the blood. Because you didn't get the blood, it could be fault with the mannequin, or you didn't get the blood, it could be by chance as well. Because in real life also, it's not like you got the blood every time, isn't it? So that's not the failing point. So your procedure should be right, plus needle should be discarded properly, plus, what else? And make sure you open the tourniquet on time as well. Okay. So that is the thing, right? Will the examiner in the station interrupt and ask us clarifying questions? See, examiner can ask you and stop you at any time. Okay? Examiner can stop you anytime. That's the thing. So if they stop you, just answer their queries. Yeah, mostly they don't do it, but in some scenarios they might do it. For example, here if you need to get the plasma paracetamol level, so they'll stop you and give you the sampling report. And if they want to know about like the which color bottle that we are using, so yeah, they might be stopping you, right? So that is the main thing. Yeah, right.